Hello, I'm Dr. Pavel Espinal. I'm an orthopedic surgeon and I make sport medicine and I live in the Dominican Republic. I will show you a presentation of the ACL reconstruction using the quadricep tendon. First, we have to know that anterior cruciate ligament reconstruction is a very popular surgery in the United States. We see one in every 3,500 people have an ACL lesion. That is the amount of at least 1,000 reconstruction of the ACL every year. We have different types of problem when you have an ACL lesion. The first one is the meniscal tear. Levy and Mayer have demonstrated with the article that they published that you have an incidence of meniscal tear after an ACL lesion in 1 year in 40%. But when you have an ACL lesion, you have the possibility to have a meniscal tear when you have the ACL lesion more than 5 years, more than 60%. When you have more than 5 years, like 10 to 15 years with a ACL lesion, you have changes of your bone, like osteoarthritis. You have to know when you have a ACL lesion, at least for 10 years, you have a 60 to 80% of possibility of have osteoarthritis. You have many options to make the ACL reconstruction with the graft, with the option of the graft. The first one is the bone patellar tendon bone graft. This one is very useful because you have a bone block that causes you of the healing and the integration of the tendon in the bone. But they have so many disadvantages. The one is the anterior knee pain. The other one is that the donator side have some kind of problem because we have shown that 6 in every 10 patients have some kind of problem in the patellar bone. Can occur a fracture in this side. The other one is the hamstring tendon. The hamstring tendon is a very useful tendon and have the equivalent of forces and avoid translation and rotation similar to the patellar tendon autograft. But they have one problem. They have the donator side of the hamstring have so many deficiencies. The other option of graft is the allograft, but you have to know the allograft is a very complicated uh, graft because we have two disadvantages. The one is that you have more kind of incidence of infection and some kind of failure of the tendon. But the good one is that you don't have to use any donator side. The final option that we have with the autograft is the quadricep tendon. We have two options of the quadricep tendon. We can use the quadricep tendon with a bone block and the other one with a free central tendon. The two options are good and are very popular now because they have so many advantages. The first one is you don't have usually any problem in the donator side. The other one is that you have a more aggressive rehabilitation and you don't have to use so many medication for the pain and you can use more flexion and extension rapidly immediately after the ACL reconstruction. We present now the ACL case with the guy of half 19 years old is a football player and we will show you now the surgical technique. The first one that we make is a drawer test. We find a positive drawer test in the operating room. Then we make a incision in the superior pole of the patella, like 4 to 6 centimeters. We measure, we make the marcation of the tendon of the central bone. Then we meet the diameter that have to be at least at 8 to 10 of millimeters of diameters. But in the length, we use normally like 120 to 140 of length. Then we begin the extraction of the tendon with the bobby. We have to use a very good long and strong tendon. Then we measure the tendon. We have the at least 120 millimeters that we before tell. Then we usually make the regular arthroscopy. We make the femoral tunnel and pass. Then we make the tibial tunnel in the footprint that we have in the tunnel, in the tibial tunnel. Then we pass our tendon that you see is a very good tendon with a good diameter. And we, in this case, of the size of the ligament, we extract a screw interarticular for provide more tension of the ACL reconstruction. Then we make the proof of the drawer test, and you see it's a good reconstruction. And the conclusion, the use of a central free quadricep autograft is a useful tool, and parents have a little tight dimension for the used hamstring autograft tendon. In the post-operative of the hamstring, we control less side extraction. We have less problem in the side of extraction, and you can do a very aggressive rehabilitation, and you have at least amount of comorbidities. Thank you.